Thank you so much, Maritza. Now we have Doctors Carrie Redlick and Dr. Queenie Abad from Yale Occupational and Environmental Medicine to talk more about the virus itself, how it's communicated, how you protect yourself, the masks, the different types of masks, the pros and cons. So, doctors, thank you so much for joining us this afternoon. Take it away. You have to unmute. You're on mute.
I'm
You're on mute.
sorry, I thought
There you
there it is. Okay. I'm Dr. Carrie Redlick. I'm director of the Yale Occupational Environmental Medicine Program. And our other doctor is Dr. Queenie Abad, who's one of our occupational health physicians. So, and hopefully we'll have time for questions at the end. So Queenie, I'll let you start.
Okay, thank you, Dr. Redlick. And so this portion of the presentation will, like Kathy said, focus on how the virus is transmitted, and really will focus on what employees and everybody can do that's in their scope of influence to protect themselves when they are going to work and also when they're going out in public. We did a similar talk with cafeteria workers a few days ago that was well received. I'm going to go to the next slide, but thank you for inviting us. So we'll just go over a very brief COVID-19 overview. As you know, the SARS-CoV-2 virus is the virus that causes the COVID-19 disease. It is a coronavirus, and there have been other outbreaks of coronavirus, SARS and MERS in the past. That was in 2002 and 2012. And so one of the main ideas to take away from this talk is how SARS-CoV-2 can spread. So as Connecticut is reopening, the virus has not gone away, but by knowing how the virus is transmitted, we can then identify areas of risk and then really how to mitigate those risks and to protect ourselves. And one way to do that is know how SARS-CoV-2 can spread. So the main way that the virus spreads is via respiratory droplets. And so what does this mean? If you look at this visual here, when somebody who's infected coughs, there are droplets in various sizes. There's large ones that drop to the ground. There's medium-sized ones that can go a few feet. But then when someone sneezes or sings, there are smaller droplets called droplet nuclei that can travel further. And so those are the ones that we can't see. And so they can happen when we're sneezing, when we're coughing, talking, we're producing respiratory droplets, which can then land in the mouth of somebody else on a surface that then gets contaminated, etc. And so that's the main way it's spread, via respiratory droplets. The other way, secondary way that it can spread, I mentioned already, is through these contaminated surfaces. Let me see here. Oh, I think I went. Okay, here you go. So I was gonna play this sneeze cloud, but since we're got started a little bit later than planned, I'll just talk more about when somebody coughs. I already mentioned big droplets fall to the ground. Medium-sized ones travel a little bit, a few feet, then the really tiny ones can travel further. And so the sneeze cloud just shows these droplets as they're going through the air. So symptoms I won't talk about in extents, but when somebody is infected with the virus, they can go 2 to 14 days after they're exposed and not have any symptoms. But within these days and after, the person who's infected can exhibit signs of the virus, like coughing. One of the main ones, fever, chills. One of the other ones that have been coming out about the virus is loss of sense of smell and loss of sense of taste. And that's something that's been really specific to SARS-CoV-2. And other individuals can go on to get shortness of breath and some with pneumonia. There have been some GI disturbances, but those symptoms have been less common. So these are the few ways that someone who's infected can exhibit symptoms. There are two main ways that we can test for exposure to the virus. The main one that has been given out to people when there's a suspicion that they have a current infection is the viral test, the nasopharyngeal swab. So that's the graphic up here. There's a swab, and somebody puts it into your nasopharynx, inside your nose, and puts it deep enough so that it can get a sample in your upper respiratory tract. Okay, so this nasopharyngeal swab shows if you have current infection. You're currently infected now. So it can provide fast results, but the main thing is you need a good quality swab for it to be accurate. And because of the test characteristics and the quality of the swab that you need, it can have some false negatives. The second main testing modality is via an antibody test. And this has been talked about in the news more recently. This is a blood test. Compare it to the nasopharyngeal swab for the viral test that I just talked about. So this antibody test, blood test, shows if you have been exposed to the virus in the past. And studies have shown it takes about at least 10 days after exposure and infection for the body to produce antibodies. So because of this, it may not show current infection. And like I said, it takes several days, a couple weeks, for the body to make these antibodies. I've got the window open, so that's what the noise is. So there needs to be ongoing studies on how we're going to use these antibody testing. There's been a lot of talk about using it for deciding whether someone can return to work, but that's not something that we're doing right now. And the fact of the matter is the antibody test and what it means, it needs more studies. And we've got a study going on at our department now to learn more about the antibody protection and how long someone can remain immune if they can become immune if they develop antibodies. So those are just the two main types of testing for coronavirus. A lot of the questions that we get are individuals asking us what their chances are for getting COVID-19. And the answer to that is it varies. We can think about it in kind of three main risk categories. This is a graphic from the CDC. And so, over here on the left side, we consider someone low risk if the individual is just in the same room for a short amount of time with another individual who is confirmed to have COVID-19, but they're more than 6 feet away. So just being in the same room for a few seconds, couple minutes, you're low risk as long as you're more than 6 feet away from that person. In the medium risk category, this really means you're in the same room as the symptomatic individual, and you're within 6 feet of them for a prolonged amount of time. Now, what's prolonged amount of time? We consider prolonged amount of time as being 10 minutes or more and being in close contact with the individual who is exhibiting symptoms. So people who are in this medium risk category may be individuals who are caring for someone who has COVID-19, and they're having to spend a longer duration of time with them in the same room. Okay. In the high risk category, that's basically what I just talked about. Someone who shares the same living quarters. So you're in the community, you live with somebody, a partner, kids, or whoever else, and you're living in the same space, you're breathing the same air for longer than 10 minutes, hours, the whole day. Okay, so this is someone who's caring for someone who's actively sick. And these are really how we should think about categorizing our risk of getting COVID-19, okay? So what we do in occupational environmental medicine is, pre-COVID, what we were doing was assessing workplaces for exposures, okay, assessing hazards. And so whether it's a chemical hazard or a physical hazard, or in this case of COVID-19, whether it's an infectious hazard, we think about identifying and correcting the hazard in the same way. And we do this by using something called the hierarchy of controls. And so if you look at this graphic, it's an inverted triangle, and we go from least effective measures to the most effective measures. And as you can see here on the bottom, PPE, aka personal protective equipment like masks and gloves and gowns, are ways to protect oneself from exposure to the virus. But as you can see, it's down here on the kind of the, quote unquote, least effective end. And so what we like to do is all of these are important together. So when you're in a workplace, the workplace should be doing PPE, administrative controls, and engineering controls. Administrative controls change the way people work. So you've probably heard about people changing shifts or clustering how many people are in a shift, okay? These other examples are increased training for employees, increasing signage, staggering shifts, like I mentioned. We go up to the yellow here, which are the engineering controls. And so when we're thinking about an engineering control, these are really ways to separate the person from the hazard physically. So these, you've probably seen in the grocery store, plexiglass barriers, moving things outdoors, improving ventilation and air circulation inside the facility. The most effective controls are up here, elimination and substitution, but unfortunately, we do not have the capability to eliminate the virus from the world yet. And, substitution's not gonna do much. So when we're gonna go forward and talk about specific examples of changes in the workplace, we're thinking about this hierarchy of controls pyramid, okay? So down here in PPE, when we're talking about the general population, why are we wearing masks and why are other people wearing masks? Well, if you remember from several slides ago on what is the main way COVID-19 spread, it's via respiratory droplets. And so wearing a mask, like these individuals here, prevents this person who, maybe they have a cough or runny nose or sneezing, it prevents them from spreading their droplets to the other person. And the person wearing it, they can be protected from this person's physical droplets from going onto their noses or their mouths, okay? And so as far as CDC recommendations, right now, individuals should be wearing masks, cloth masks in public at all times, and especially in scenarios where it's impossible to maintain a distance of more than 6 feet. Okay. And so something that, you've probably seen when you're walking around is, people are wearing masks, but um, because they're wearing masks, there's this idea that, oh, I must be protected. And, they're standing within 6 feet of each other. The important thing to know is masks are not a substitute for social distancing of greater than 6 feet. Okay. We need both. So what does this look like in the workplace? And so there's the document here, the hair salons and barbershops document from the Reopen Connecticut guidelines. And so that will talk about specific barbershop and hair salon recommendations. We're going to be talking about general ideas here, okay? So when you're wearing your mask in the workplace, you need to wear it throughout the day. And the most important thing is that it's worn the correct way. And, sometimes you see people with their masks on their chin, or their mask is only covering their mouth. Remember, for the mask to be most effective, it should cover both your nose and your mouth, and it should be secure and close to your face, okay? It's also important that you clean your mask regularly, especially if it's a cloth mask, and to not share it with other people. Okay, another PPE that has been worn a lot are gloves. And so I forgot to edit this last side, but you'll wear your gloves using the regular procedures when you're doing the work in the salons and in the barbershops, okay, to maintain safety. Another question that we often get are, which masks should I wear? There are, for the general public and for people like in healthcare and in manufacturing, there are 3 types of masks that individuals will come across. This one here, and I will call it teal color, is the N95 respirator mask. Okay, it is FDA regulated, and it's called N95 because it has the ability to filter out 95% of the small airborne particles in the air. Okay, the main thing here is these are should be reserved for people in close contact with symptomatic individuals who are ill, i.e. healthcare workers, okay? So individuals who need N95s are the healthcare workers. The next mask that people have probably come across are surgical masks, okay? So these surgical masks are the ones that healthcare workers also wear, okay? And their use is to protect against large droplets and splash of bodily fluids like blood or phlegm or sputum from patients, okay? For the general public, the masks that are recommended by the CDC for the public are the cloth masks. So if you're asymptomatic and you're part of the general public, these are the masks that are recommended, okay? So the main point on this slide is when you wear the mask, you're protecting other people from your respiratory droplets from falling on them if you're infected. And number 2, the mask that's worn by other people around you are there to protect you from their respiratory droplets. Okay, and like I said, the recommendation from the CDC is that people in the general public wear the cloth type face masks. I already mentioned a little bit about, if you're gonna wear the cloth face mask to be effective, please wear it the correct way. Okay, so when you leave the house and you're in an area where you cannot social distance more than the 6 feet, you need to be wearing the masks. Make sure, like over here in the picture, that it's fitting closely to your face. You can probably you probably have seen when you wear your own mask that sometimes you can see gaping holes. So make sure that when you are wearing a mask or you're getting it made, that it's fitting snugly over your face, so that you don't want to impair or decrease the way you're breathing, but make sure it's not wide and gaping open. All right. The most important thing is that it fully covers your nose and your mouth. And so there's been studies on how effective are cloth masks. The general principle here that I want to communicate is the more layers that the cloth masks have, the better it is as far as protection. You don't want to wear too many layers to the point where you're having trouble breathing, but having 2 or 3 layers is probably better than having, one thin, flimsy layer. All right. And, you have the secured ear loop ties so that it doesn't move. Okay. So next slide here is just talking about how to properly clean and remove the mask. So the main thing here is before you touch the mask is you wash your hands when you touch it or adjust the mask, okay? And so after you use the mask, try to grab it by the ear loops, not by the cloth side. And do not touch your eyes, nose, or mouth, okay? After you handle the cloth mask, it's important that you then go and wash your hands. This one here, not sharing masks, is, doesn't need to be said. And as far as cleaning, laundering it with your regular detergent and water is going to do a good job of cleaning the mask. Okay, you can do it on machine dry hot. And make sure also to store it in a clean container. So, you want to put it in somewhere where the mask can breathe. So, you can use a brown paper bag, which is what we use here in the clinic when we're using our masks here. So this is something, so an administrative control is changing the way we work, meaning washing your hands more often, okay? And so the most important part about this slide is that, yes, you should use soap and water to wash your hands, all your fingers in between the crevices, the nails, and you want to do it for at least 20 seconds. Soap and water is the preferred option, and you should do it frequently throughout the day, but especially before you're eating and after you're eating, just because you're handling, you're touching your mouth and your nose when you're eating your meals. Everybody knows after using the restroom, when your hands are visibly soiled, and then after you're going into so after a day's work, you're going home, you closed up the shop, you're going into your car, driving or walking or riding the transportation back home. When you enter your house, the first thing that is recommended is that you go and wash your hands afterwards, so that you can come in and have clean hands. Okay, so the other question we get is our questions about hand sanitizer. And so the preferred option, like I said, is soap and water, and especially if you see dirt or any fluids on your hands. But, we use sanitizer in situations when there is not soap and water, okay? So if soap and water is not available, you can use hand sanitizer, but make sure on the bottle that it's the type of hand sanitizer that will work. And so you want alcohol that's 60 to 70%, and that's best to make sure it's effective. All right. And so when you're using hand sanitizer, it's important to also use it the correct way. So, cover the surface of your hands, rub your hands together until they're dry. And the main point here is, hear a lot about homemade hand sanitizers or essential oils. Our recommendation is that we stay away from homemade products because we don't know what the quality control is or their efficacy. So if you're going to use hand sanitizer, you want to make sure that it's something that is going to work. So at least 60 to 70% alcohol. So the next section here is environmental cleaning. Okay, as you recall, this second way that the SARS-CoV-2 virus can spread is via a contaminated surface from somebody's droplets. Okay, so the main thing is if we have the right disinfection products, these products can effectively kill the virus, specifically SARS-CoV-2. Okay, and the main thing here is that we need to be using the right products. So there are pretty much two steps when you're cleaning and disinfection or cleaning and disinfecting. Okay, and they're different. So cleaning is using soap and water to physically remove any visible dirt or debris. Okay, you're not killing anything when you're doing that. The other word you're going to hear is disinfection. Okay, disinfection is the specific term to use when we're talking about killing germs on surfaces. And we want to pay attention to high touch surfaces. And what high touch surfaces means is basically think about all the things that we're touching a lot throughout the day. Doorknobs, your keys, if you have a badge, cash register, steering wheel. I'll have a few other examples later in the slides. The main point here is that we need to use the right stuff. And so if you go onto the CDC EPA website, there is a list of EPA approved disinfectants. They're all different. And so it's really important to follow what it says on the label. All right. The next one is bleach. Bleach works really well with killing the SARS-CoV-2 virus. Be very careful with bleach because the solutions that you can find in the stores are often 100% bleach. They are not diluted. And bleach can be very dangerous if you're using it undiluted. So make sure you look on the bottle and see if it's already been diluted and ready to use, or if you need to go through diluting it with water, adding water. I actually had a bleach burn at the clinic several weeks ago, so I know how powerful bleach is, which is good, but it can be bad if someone does not know what type of bleach they're working with. And third, alcohol solutions that are at least 70% and hydrogen peroxide. We're actually using both of these in the clinic. Alcohol solution in a bottle, that's 70%. And then we also have hydrogen peroxide that we use to spritz our check-in area at our clinic. Okay, and so we hear a lot. The other thing about disinfection is we hear a lot about contact time. How long does the surface need to be wet with the solution, whether it's alcohol or hydrogen peroxide or bleach, in order to work? It depends on what you're working with, but probably with things like bleach, 5 minutes is probably enough time, or even I've heard 3 minutes is probably enough time. In this document, I did notice that it said 10 minutes. And so, if the document says 10 minutes, it's probably the best idea. It's not going to hurt adding 5 more minutes of waiting and allowing the disinfectant to kill the germs on the surfaces. Okay, so 10 minutes is going to be plenty of time to be able to kill the virus if it is present on a surface. So let's see here. The most important thing on this slide about environmental disinfection in the workplace is really disinfecting those high touch surfaces, and especially if you are sharing surfaces or tools. So think about, here at the clinic, we've got one computer at the desk, okay? And 2 or 3 people can be typing on that computer. And so if it's a shared surface like that, after every use, it should be disinfected. Okay, so cash registers, computers, if you don't have things like contactless payment, the reception desk, the light switches, the door handles, and especially working in barbershops or hair salons, I know that a lot of people have their own workspaces and probably have their own tools that they use. But if you're swapping tools or if you're sharing workspaces, make sure that before you transfer it to somebody else that you are disinfecting it. Okay. um let's see here. Personal items are sometimes are things that sometimes we can forget about, including me. So think about cell phones. How many times a day are we touching our cell phones and texting and calling people? And the case, your eyeglasses, your keys. And so these are all the things that have are high touch surfaces, which should be disinfected. Okay, so this is just a picture of a couple workplaces that are doing engineering protocols. And so these protocols physically isolate the worker from the hazard. So, think about when you're going to the grocery store and there's the plexiglass, the drive-through windows. And then here, you see here at this nail salon, they are both wearing masks. They are, and there's this plastic plexiglass barrier, aka a sneeze guard, that's up, that is physically isolating the worker from the customer. Okay, so this visual is something you guys have probably all seen if you reviewed that reopening Connecticut processes for the hair salons and barbershops. And so I just took this image that I found in there and blew it up. So this is what the hierarchy of controls is going to look like in a barbershop or hair salon. All right, so let's start here at the entrance. This person has access to this hand sanitizer before they enter the building. Okay, when you go into the building, you see that there is not other people waiting. So that's part of socially distancing individuals, and also I would say part of an engineering control. Okay, because you're having people wait outside instead of waiting inside, where you can potentially be breathing the air that another person is breathing. Or okay, so like here, no waiting areas, so appointments only. Okay, and when you go into the facility, you can see that both the customer and the worker are wearing masks. The workspaces are 6 feet apart. There's disinfectant wipes here at the table. And here they have implemented contactless payment. Okay. All right. So this is the last slide that we have. There is a hotline if a worker or customers also feel like the workplace is not safe. Okay, so if someone would like to report a violation of a work area, there is the state hotline. It's 211. And just remember that you're protected for voicing your concerns. Okay, employers may not retaliate against workers for raising their concerns about COVID-related safety and health conditions. So remember, if you have concerns, it's always safe to call this 211 number. Okay, so as far as the summary goes, remember that the primary spread of SARS-CoV-2 is from droplets. If you know about the hierarchy of controls, you can identify where the risks are and you can engineer them away. And you can, and this is really the basis of many of the work policies. Okay, so the things that we talked about here are allowing you to decrease your risk of SARS-CoV-2. Okay,